name is Danielle. I am a student here at Dixie State, and I am doing my project on outpatient clinic encounter workflows. So, a little bit about myself and my preceptor. I have been in healthcare since 2010, so 11 years now. I started my career as a CNA. I worked at a nursing home and then moved to inpatient medical oncology. I worked there as a CNA and a HUC throughout nursing school. When I graduated, I stayed there for a little while, became a charge nurse, and I really liked it. But I decided to move to the outpatient world just for the schedule and all the kind of benefits that come with outpatient work. Um, my goals are to make a difference in healthcare, meaning both my patients and my coworkers and those who I am leading. Um, I think there is a lot we can improve in healthcare, and when we decide to make a difference and really work hard to change things for our patients and for those up and coming in healthcare, I think that's really important. Um, I also want to, my ultimate goal right now is to become a nurse manager. I'm on a decent career path for that. I'm currently a clinical nurse coordinator, so I'm essentially an assistant manager in my clinic. I really like that because I get to do a lot of patient care and kind of the clinic work, but I also get to do some more of the administrative side and help my manager do various things like, schedules, disciplinary action, all that, kind of just regular administrative functions. It's also been really fun because I've learned a lot about leadership and I've kind of had to grow into more of a strong leader, someone who's willing to step up and take charge of things rather than kind of waiting for instructions. That being said, that really helped me with this project because I was able to kind of implement this and learn who to ask for help, which kind of leads me on to my preceptor, who is a manager of one of our neighboring clinics. I chose to have him be my mentor because I wasn't as familiar with him and I really wanted to learn kind of some new leadership styles, not just the one I'm used to with my manager. I think he has a great relationship with his staff and he really is running that clinic well. So he was a great resource to have. He helped me join some meetings with various leaders around our organization. He helped me write emails, get people to come to our there's some different meetings we run. He helped me find people to present, helped me work through some of the details of the project. So it was really cool to be able to build a relationship with him and with the other people I was introduced to through this project. So to kind of get into the bulk of the project, our clinic flow, we have about 30 doctors, we have about 20 medical assistants and 4 nurses, including myself and my counterpart. We're both the CNCs in our clinic because we run 2 buildings. So there's a really big group, so we're split into essentially 4 teams of medical assistants, nurses, and physicians. Each team is kind of responsible for managing the incoming patient encounters through telephone calls, patient portal encounters, through MyChart is what it's called, and clinic visits, things being routed from the providers. We have some various stations throughout our clinic. So as I mentioned, we have 2 buildings. In each building we have MAs who do rooming, so they're assigned to their providers for the day. They room those patients, bring them back, checking vitals, things like that. We have phlebotomy rooms at each clinic, so we have an MA that's assigned to draw blood. And then at one of our locations, we have an incoming call center where we have 2 or 3 MAs at a time staffing that, taking incoming calls with patient questions or refill requests, concerns, medical advice, requests for forms to be filled out, things like that, just various patient needs. The staff all have various duties. So as I mentioned, we have those stations around clinic that they stay pretty occupied with, but they're also assigned to specific providers for their encounters. So like as I mentioned before, the telephone encounters, my chart encounters, things like that. They're responsible for handling those as well. Organizationally, our expectation is that patient calls, messages, encounters are responded to and resolved within 2 to 3 days. Occasionally, we cannot accomplish that because, it's maybe a complicated need. We have to ask doctors. Maybe doctors are out of town. Maybe it needs input from a pharmacy, or we're waiting on a response from an insurance company. There's a lot of things that could really impact that. But the expectation is that we attempt to work on that. We don't just let it sit. So the purpose of my project was to improve a couple of sections of things. Patient care, we want those issues to be resolved in a really timely manner. I wanted to improve the amount of time it was taking to get an encounter completed, meaning that the patient is waiting less time to have maybe their disease is flaring and they needed steroids or something like that. Instead of waiting 3 days for even a response, now they're getting that treatment within a day or so. This reduced wait times also improves our patient outcomes. It improves any confusion coming from maybe encounters being bounced around. They're getting information from the medical assistant. They're getting different information from the nurses. Really kind of streamlines everything. That's important to clinic flow for both our patients and for our providers and our staff. With a really set process for how things are handled, that makes it so the staff knows exactly what's expected of them, what their role is, how much autonomy they have, and really allows things to flow smoothly. This being streamlined also helps our providers feel more satisfied because they're not getting multiple encounters, they're not getting questions that could have been answered by somebody else. It's really allowing them to kind of have a less bulky burden. So originally in our clinic, we've kind of, as we've grown a lot over the couple of years, we've kind of changed things. We built pools for encounters. So we had, as I mentioned, our 4 teams of medical assistants and nurses. Messages are sent to the appropriate provider team. But it really started with, it would go into those pools. The medical assistants would initially handle that. They would see what they could do, help the patient get something started. And then they would forward this on to the nurse team, and then we would forward it on to the providers. This approach didn't really allow for a lot of streamlined care, caused a lot of confusion because some medical assistants were, a little more educated, or they had a longer practice, and they'd be providing information to a patient, whereas the other medical assistants were not providing that same kind of information. Or maybe they gave them a conflicting answer to what we or a provider would have given them. It was also creating, a lot of delays because things were being bounced around. It was getting sent to a nurse or back to a medical assistant, or it was sitting in the medical assistant pool. Just kind of made it really chunky. This approach did allow for the medical assistants to have more autonomy because they were able to give, answers to patients, send in lab work, things like that. But really, that wasn't good patient care because they just weren't getting the right answers or the right, stuff sent back to them. So in this kind of updated process that I've created, I kind of reversed the flow of how messages were being sent or encounters were being sent. We set it up so that through IT, they changed all the messages to come directly to the nurse and main pool first, so that we would be able to triage each message, meaning that we could, say, hey, this needs a refill or a different pharmacy or something like that, and we could just do that based on our protocols. We could say, oh, they just want this to go to a different pharmacy, boom, it's sent. Or, triage that, say, hey, I need to ask you these questions. We need to find out exactly what's going on. Is this an urgent or emergent need? What do you need? From that point, we could send it along to the medical assistant, and we could say, hey, all this patient needs is, updated lab work, or please request these external labs or results. Please schedule this patient, something like that. Or if it wasn't appropriate to go along to the medical assistant, we would send it along to a nurse practitioner that we work with that helps us to triage disease flares and urgent needs and kind of get them taken care of in that way. Or if it's not urgent or emergent, or if they really just need their attending provider to give them information or prescribe a drug or something, then we would send it along to them. So this really reduced the amount of times each message is being routed. There's a really set process. We know what our protocols are and what our scope of practice is, allowing us to just get things sent without being bounced back and forth with questions. This really allowed for a lot more communication. We were able to discuss these, needs and education with our APCs and with our providers, so we got to kind of work more as a team. This also streamlined the care the patients were receiving from our clinic and resolved their issues much faster. So just totally improved resolution. If you bear with me for just a moment, I am going to switch screens so I can share some spreadsheet data with you. So this spreadsheet here will show you some information from before we started our practice. I'm sorry that the screen looks a little bit bulky. So these are the patient MRNs, and if you see here, this column shows how many times each encounter was routed back and forth. You'll see this one right here routed 13 times, routed incorrectly. Down here you'll see 11 times. Those are both really unacceptable. Like some of these 0 to 3 times, that's great. That's kind of what we want to see. Not a lot of bouncing around. And over here you'll see kind of a long days to resolution time. The 0 means that it was resolved in the same day. Down here you'll see a couple of these messages were routed, had 42 days until they were resolved. Now that could be that there was a delay somewhere, but it also could be that it was bounced a lot of times, or it sat in a pool somewhere. I made a note over here that apparently that particular encounter had been opened 21 times without being resolved or completed. This is exactly the kind of issue we're avoiding. So also down here, this is just showing how many messages were in each pool, kind of depending on the time of the day. This shows our entire clinic teams. You'll see that there's not a ton in each pool, but it is kind of a lot of messages altogether. And then over here I have noted, so for our pre-pilot, before we started anything, the average time was 6.5 days until the encounter was resolved. Now this spreadsheet will show you the same information, but this is during our pilot once we kind of reversed that flow. We started with one team. We kind of gradually brought all the teams into this. So let's see here. You'll see the days to resolution. 0 means within the same day. So you'll see a lot of these had a same day resolution. I would say the majority of those were resolved the same day. Routed very little, 0 times sometimes. So 0.1 was kind of the average times routed. And then our days to resolution was so much shorter here. Sorry, it's not scrolling. 0.9. So that's less than 2 business days to be completely resolved. Majority of these were being resolved same day, which is amazing. That's great news for our patients. Now, in this one, I'll show you. Oh, geez, sorry. In this one, you'll see that this is some data that I pulled after we had finished our pilot and pulled all of our teams into this project. I, unfortunately, due to time constraints with the course, I didn't have time to pull as many counters as I had pulled for the pilot. I have about 15 encounters here, but even still, you'll see that our times routed is great. So our resolution times, and times routed, this is really good news for our patients still. So this is a couple weeks later, we're still doing really well. A little bit increased from our pilot time, so 1.2 days rather than the 0.9. Some of this data was skewed just a little bit though because of a holiday weekend. But that's kind of the another, again, the nature of healthcare. Sometimes we're going to see these one-offs and things that cause little hiccups. But what we see overall is that the project is working and we're having some success with that. 7 times faster. That's amazing patient care. So we were able to resolve their issues, like you saw, within now after the pilot, 1.2 days. So evaluation, we kind of reviewed that spreadsheet data. I think that that data in itself really proves that we have some great success. Um, we've seen that there's a huge improvement in the time that it takes to help our patients and get them totally taken care of. This benefits both our patients, of course, and then also our department because, when patients have their issues resolved quicker, we're going to see better scores. They're going to feel like they're being taken care of. That really is a huge improvement in quality. And the faster we can get through, the faster we get through it, the more patients we can see, the more patients we can care for. That has financial implications too. We're being more efficient. That's great for our labor efficiency. Looking at this project and working with my mentor and seeing, how much I've put into looking into like growth opportunities and relationship building, things like that. I really feel like this project has helped me to become a better leader. I've really had to step outside my comfort zone and kind of come to terms that some decisions we make as leaders are going to make our staff and our coworkers mad, and that's something that unfortunately is just what has to happen in order to change things to make our clinic run more smoothly and to help our patients receive better care. I feel the same as the conclusion and the summary, pretty similar. Overall, the project was successful. I feel like I learned a lot. I was able to build a relationship with my mentor and with other leaders and kind of show my team that I'm here to help make improvements and to really lead the way. I'm happy to answer any questions you might have. Let me know if there's anything that wasn't clear.